the most intriguing and I guess one of the most things that I'm most excited about that we have in our office that we've been using for several months now is the Healthystart system. We've seen a lot of inquiry from parents about this system, those people that are trying to avoid braces for their children. And this system is the ultimate kill two birds with one stone system. This was developed by an orthodontist. He's been doing this since the 1970s. But essentially what Healthystart is if you notice your child has dark circles under their eyes, they're mouth breathers, and they have some other symptoms, and we have a whole form that you guys can actually see the symptoms. Hyperactivity, things like that. If you're noticing that in your child, and you're also noticing that their teeth aren't exactly straight or looking like there's going to be some crowding there, the Healthystart system is for you guys. It's going to be for your child. It is a fantastic system, and we've seen a couple patients we started several months ago. We're starting to see some really good results, and I'll show you guys some pictures of a before and after that several other practitioners have done. Essentially what the Healthystart system is that we have two different devices. We have a habit corrector, and then we have a device that actually will help straighten the teeth. We utilize both of these devices at the same time. The habit corrector is primarily used for about 3 to 9 months to help fix any sort of breathing problems and sleep problems that your kid's having. The number one problem with kids and sleeping is pediatric apnea. And that is where if a child mouth breathes and their chin drops back, they're going to pinch their airway up to 90%. So they're going to pinch off that airway, not allowing that oxygen to get down in their lungs, which triggers, just like adults, sleep apnea type symptoms, sleep apnea type situation. This habit corrector will allow your child's mouth to stay closed and not allow that chin to drop back and pinch their airway off. It actually does a couple other things as well. And I don't know if you guys can really see it, but if you check out the Healthystart website, they actually have the pictures of these devices much more clear. They have tabs on the top. There's an area for the tongue to sit. And essentially what that's trying to do is actually shape your child's mouth properly. The wings on the top are going to try and expand the child's palate very gently over a long period of time. And the little tongue portion is actually going to help your child's tongue sit in the proper position. Essentially what we call that is myofunctional training. The device is actually training the muscles of the mouth. So that's used to primarily fix the sleep problems. And after about 3 to 9 months, we generally see kids that will actually have those sleep issues resolved. What we then do a lot of times is if you're starting out with permanent teeth, your child will have to do some active wear in what we call the G appliance, the ortho G appliance. And actually we have an example here in this picture. You can see this device actually has slots for your child's permanent teeth. And as they lose their baby teeth, you can see one missing here, that permanent tooth's only going to have one area to go into. In other words, it's only going to have one area to erupt to. The idea is this. The difference between braces and Healthystart is that braces is as if I had a porcelain pot and I broke it, and then we glued the pieces back together. So we let the teeth come out into the mouth, and we let them go wherever they want to go, and then we move them to the position we want them. The Healthystart is as if you start off with this pile of clay and you mold the pot to the perfect shape to begin with. And the reason why that's important is that when teeth erupt in the mouth, the ligaments are very much set where they're going to be. And I know I see adults all the time where they have relapses after orthodontic work where teeth begin to start crowding again. And largely that's due to also the pressure of the tongue and the lip over time, but it's also the ligaments wanting to move back to their original position. So what we find for retention or using retainers with Healthystart is that it's a lot easier to retain these teeth in the proper position if they erupt in the right spot. That's what this Ortho G appliance does. It does what we call guided tooth eruption. And I actually have a couple pictures of what this can do for us here. So we'll go ahead and change that over. So this is a fantastic example. You can see this child starting at 5 years old. You can see the chin is retruded. Things have not developed properly. And a retruded chin is actually going to increase your chances of that chin dropping back and pinching that airway off, causing these pediatric apnea issues. You can see she wore the habit corrector for probably a couple months and then got into the Ortho G appliance. And you can just see how much proper growth she has to increase the position of that mandible. That allows that airway to stay open at nighttime. And you can even see just in the eyes here, there's a little bit of that dark circle here, and then you see here there's not as much dark circle, so she's actually sleeping a lot better. In the mouth, you can see preoperatively, 5 years old, you see the spacing, things are not in the right position. after using the Ortho G appliance, you can just see how straight these teeth are, and this is done without braces. This is one of the most fantastic things we have in the office, and it's one of the most exciting things that we've brought in. My 4-year-old actually uses the habit corrector right now. We can start children starting at 3 years old, so don't feel like if your child doesn't have permanent teeth quite yet, that we can't start them off in the system. We can start at 3 years old with a toddler-size habit corrector. The ideal age to start with this is around 6 years old. When you see your child losing their first baby tooth and you see the edge of that first permanent tooth coming up, that's a great time to come into the office and come get your consultation. And we can start planning out their Healthystart system early. There's a lot of success if we start around that 6-year age. Now, that doesn't mean that we can't do it at 10, 11 years old. It just means that the closer we get to having all the permanent teeth in there, the more difficult the case becomes. So I would encourage you that if this is something that you're interested in, please bring your child in right around age 6 when they lose that first baby tooth. And if you guys need more information, I mentioned it before, the Healthystart website is a plethora of information, and they've got various case examples, testimonials, things like that. And of course, if you need more information, give us a call here at the office.